Hi, welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, the Attorney General, Tom Corbett, who's running for governor, made some interesting comments. The jobs are there. Well, the reporter that broke the story is with us. Plus, guess what? The new health care reform bill. Is it reform? We'll find out. But more importantly, what does it mean to the business community? That and more when Pennsylvania Newsmakers returns.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hi, welcome back to the program. Oh, I forgot, Pennsylvania politics in depth and in detail. I was supposed to say that before the jump. Is that it? Before the break? Is that what you call that, Scott Detrow?
That's what we call it, the break, yeah.
That's what they call it, the break. There you go. Scott Detrow, Pennsylvania Public Radio. Well, I'll tell you, Scott, you've created. I'm going to blame this all on you. One of the state's leading reporters was covering Tom Corbett when he made these now, I almost want to say infamous, but certainly you will agree, controversial comments. Go through this. How did this all happen?
We were having a conversation. He was Attorney General Corbett was touring Elizabethtown, businesses there, and we were waiting for one of the small business owners to come out and talk to him. And I said something along the lines of, you know, when you go out and you meet these people, do you ever get any policy ideas from that? And that started a conversation where he said, you know, I've been hearing again and again from a lot of owners that people aren't applying for these jobs. I'm paraphrasing him right here, but he basically said there are job openings and that a lot of business owners are telling him that they can't fill them because people would rather stay on unemployment and collect compensation. And then I think the poll quote was, he said the jobs are there, right. The jobs are there, but people just aren't applying for them. Of course, right away, Democrats jumped on this, all sorts of interest groups jumped on this, and they said that this was evidence that Attorney General Corbett doesn't get it, out of touch, can't run the economy of the state.
Let's walk our way back through this. Okay, this happened a week or so ago. You were covering the Attorney General, as you often do, covering the candidates. You get into a conversation. He made this comment, and at the moment he said that, you reported it. There was almost an immediate reaction that his comments, as he put them at the time, applied universally. It wasn't a limited or narrowly focused comment like, well, we know some people, but we have 9.5% unemployment. There are far more unemployed than there are jobs available. He didn't qualify. Did he not?
I think it's been interesting to see kind of the telephone game as this evolves and the way that some people have kind of twisted it. Corbett certainly was not saying every person who's unemployed is a bum and they need to get a job, you know, and that's what some Democrats, and I've seen some columnists actually portray it that way, and I think that's incorrect. But he wasn't saying, he also was not saying at the time that that was a very limited thing. I think the way he phrased it, he made it sound like there is a good chunk of people, you know, across Pennsylvania who are being lazy and not looking for jobs. But I think it wasn't like the universal people are lazy comment that it's become.
Okay, well, let's put this in perspective. Now, you've been covering this gubernatorial campaign since it began, who knows, a year ago at least. Now, is this sort of the big moment so far in the, I mean, my sense is that the governor's campaign, and I joked one time and said it was like going to a convention of anesthesiologists, you know, we were all kind of lulled. But is this the first big moment, do you think, in this campaign?
I think for Dan Honorado, it definitely is. He's been looking for an issue to...
The Democratic candidate for governor. Go ahead.
Right. He's been trailing Corbett in the polls, and he's been trying to... he's been very aggressive about going after Corbett for a whole variety of issues. For a while, he was making comments about the way that Corbett's run his legislative corruption investigation.
Right.
And this
Bonus-gate, as we often call it.
Right, bonus-gate. And this gave Honorado a soundbite length attack on Tom Corbett. Tom Corbett doesn't get it. He has no idea what he's talking about. He's naive. He's had press conferences in Philadelphia, in Pittsburgh, in Harrisburg. He's up in Scranton today. I think he's going to go to every city in Pennsylvania and talk about this issue.
The other thing about it is that the Attorney General seemed a little late in getting out front of it once he, you know, and he's apologized for it and said that he mangled his syntax or however. You can tell me how he exactly put it, but I think that's what he said. He didn't state it clearly. He apologized. He didn't mean to offend people. But he did that rather belatedly, didn't he? There were several news cycles.
Right.
And this story was covered virtually every... Go ahead.
Right. It was. And I think he's going to have to do even more backtracking now because he said And he was correct to say, I was relaying what I heard from other people. And he made very clear at the time, this is what I've been hearing. However, he started off by saying that conversation, he had a conversation with a Camp Hill candy-making company earlier that day, and the man had told him that there were tons of jobs at his company that he couldn't fill. Now, CapitalWire.com went and found this guy. We had all been looking for him and having a hard time finding this mystery person. And he told them, the Attorney General really misconstrued my comments, and he exaggerated the amount of openings and the amount of problems we've been having. So now that's another cycle that Honorado can talk about.
Now, he originally made, I thought the Attorney General originally made a comment in a sense about the construction industry.
I think he was talking about...
Did he talk to you about, did he mention construction to you?
Toward the end of the exchange, he mentioned, I've been hearing this from construction companies as well, but when he started off, he was talking across the board companies in various sectors are having a hard time. So he was talking about more than construction, as I understood it.
But let's just sort of summarize here. Number one, you think this is sort of the biggest moment in the gubernatorial campaign, certainly since the May 18th primary. You know, it's biggest moment in the campaign?
I think the Honorado camp is going to do their best to make it the biggest moment. I think it gives them a message to hammer for the next few weeks. So in that sense, yeah.
Would it shock you if we saw a television commercial in the fall about this?
It was just the right length of a comment, made for a TV commercial.
Made for TV. All right, there you have it. Scott Detrow with Pennsylvania Public Radio bringing us the update on the Tom Corbett controversy. I think it's safe to say we could call it a controversy, right?
If you think so, then yeah.
All right, healthcare, the healthcare reform bill, or if that's reform passed in March, we've got a couple of great guests who are going to come on and talk about what it means to employers, what it means to the cost both for employers and for employees. More with healthcare following these words.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania Cyber Charter School, bringing educational innovation and freedom to the children of Pennsylvania. This broadcast of Pennsylvania Newsmakers is presented by PAConstructionJobs.com. For more information about rewarding careers in the highway construction industry, visit PAConstructionJobs.com. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Hi, welcome back to the program. Well, everybody knows in March the Congress passed and the President signed this enormous health care bill. It has huge implications that we'll find out, we won't fully know about for decades, I think. Joining us to talk about an aspect of that is very important. It deals with cost to employers and employees. I couldn't have two better guests to do that. Sitting across from me is Mike Fiaschetti. He's the market president with the central region of Highmark, and Gene Barr, the vice president of government and public affairs with the Pennsylvania Chamber. Both are regular visitors, regular guests to the program. All right. Michael, let me start with you. Look, give our viewers some sense about what this health care bill means to employers in terms of the health care coverage that they're now going to have to provide, or else get fined, I presume, if they don't.
Well, there's a whole lot of implications to employers, and of course we've been sorting through that as since the bill's been passed. But I think some of the things you said, first of all, employers are going to have to provide coverage. Employers that have more than 50 employees must provide coverage or be subject to a penalty. We have a very big concern about that relative to whether or not some employers will choose just to take the penalty. So that's something that we're concerned about. But implications are there's a number of compliance issues that they're going to have to deal with initially, and then ultimately they're going to have to look at a strategy around what type of coverage and how they do this. It still focuses on how can they continue to afford.
What do you think? Mike makes a great point that many employers just might say, well, heck, I'm just going to provide the coverage. I'm just going to take the fine. Do you have any sense about the relationship between the fine and the cost? Have employers talked with you about it?
Well, I think it's a great point, and we're already starting to see, and you're already starting to see some predictions about the amount that are likely to go. Look, employers are going to run the numbers. They're going to say, I'm spending X per year now on health insurance. I could spend X, less than X under this because of the penalties. Yep. Are less than that. They're going to make that decision. Now, some of them may say, in order to continue to attract employees, I'm going to continue to provide my coverage.
Right.
But the other thing that's a piece of this is the coverage has to be approved by the federal government. You have to meet certain standards. It can't just simply be, this is my health insurance package.
Is that going to, they're setting up these state insurance exchanges, which right. I am clueless about, but you guys are going to have to come back. You're going to have to come back and make sure we understand. Do you know?
We'll fill you in.
I mean, are these exchanges going to be the place that says to, you know, somebody who owns a 45-person company, these are the rules that you have to follow? Is that basically what the exchange, without getting into the details of it?
Pretty much, unless they decide to offer health insurance on their own, the exchanges are going to mandate what benefits are offered, and there's several different levels of benefits and so forth on the exchange.
Okay, now, let's say I'm walking through so our viewers can get a sense about this. So let's say I'm an employer, I'm below 50, I say, you know what, I'm going to pay. And, you know, 12, 13 grand a year is not out of the, you do this, right? Is that out of line?
No, it's not.
12, 13 grand a person a year, okay. Is the government or the insurance exchange going to say, not only do I have to provide the coverage, but this is what I have to include in it?
Exactly. That's what it's going to have to be. You have to meet minimum standards for deductibles, for co-pays, for this, for that. And the other thing, when we get into this 45 versus 50 number, which is very interesting, because when we start looking at what the real push is now, which is jobs, if you are a 45-person manufacturing facility, you're going to think twice about going to 50 and putting yourself under this new federal law.
So before we run to break, so Highmark sits there, you insure a company, they come and they say, we're going to stay with you. You're going to then have to tell them, right, you will be your company will be explaining to the employer the ins and the outs, what coverage they must, and what it costs?
That's correct. We're going to advise them on all the issues around how they comply with the law, and then what the cost of that will be.
I don't envy you guys at all. A couple thousand pages, and once they get with all the rules, and it sounds like a little bit of a nightmare. All right, we'll be back. We're going to continue this important discussion about health care reform. Did I say that? Health care following these words.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the State System of Higher Education. 14 state-owned universities. The state system is the largest provider of higher education in Pennsylvania. And by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania.
Hi, welcome back to the program. I'm talking with Mike Fiaschetti and Gene Barr. There are experts who come in here and talk about a variety of subjects. Today we're talking about the big health care reform bill that passed Congress in March. Gene, I want to, so what advice is the chamber sort of, I mean, I know you're doing meetings and seminars, you know, you're updating your membership constantly about this bill. What are you telling employers in general about this health care bill?
Well, first off, they're going to have to understand clearly understand the law. As Mike said, there's going to be a lot of educational aspects, and a lot of this is phased in over a 6, 7, 8 year period, and a lot of this doesn't come down for a while. There are tax issues that are part of this. There are IRS reporting issues. For example, there's a piece that says aggregate $600 of business you do between you and, say, an office supply company must be reported on a form. So the only job creation likely as part of this is going to be with the IRS. So there's a lot of pieces to this, and that's why we hesitate to call it reform. It's a new program. There's lots of things that come in, but I'd hesitate to call it reform because in our view it's not going to do anything to control costs.
All right, yeah, let's talk about the cost. I mean, one of the things that I know when you've come on here over the last couple of years, you've focused on sort of the wellness aspect. You know, you have programs in which you take to employers and you say, you know, let's get these programs started. Eat well, don't smoke, do some exercise on the preventative side to try to keep costs down. And we've gotten into a lot of that with you. Is lower costs? I mean, big question mark, right?
Well, one of the biggest disappointments of the reform bill is that it's very light on really cost containment. Mm-hmm. It really is. So more than ever, employers are going to have to work with the payers and with the providers to focus on things that will lower costs. Mm-hmm. And I think there's two components. One, you articulated very well, and that's we're going to have to get people much more engaged in their health in terms of healthy lifestyles. And the second thing is we're going to have to work much more closely with the providers of care, doctors, health systems, hospitals, to look at different ways to pay for care. Right. We've got to pay for quality, we've got to pay for outcome, and get away from paying for volume. Yeah. And so we're going to be putting...
So this whole fee for service that we now have is probably going to, I mean, eventually, you know, virtually everybody's just going to be on a salary. I mean, paying for procedures and paying seems anyway like that could be gone, maybe not immediately, but eventually gone.
I think over time it will be. I think we're going to see different models of compensation, so we're all aligned. So we're all focused on quality care. That's the right care at the right time in the right place, so forth.
What advice would you give to, I mean, we have obviously employers watching this program. You're an employer out there, and all of this will, as you point out, will come down in a couple, you know, beginning this year, over a period of time. What are you telling employers, your members, for example?
Start thinking more about what you provide. Start thinking more about how you want to proceed with this. As we've noted, there are requirements. Start looking at how you want to go forward. What can you offer? Yeah. How can you make yourself an attractive employer? Because in reality, like it or not, it may be better off for you as an employer to take the penalty in future years. Because, for example, if you're 60, a 60 employee company, the first 30 are excluded. You run the numbers. You hate to say it, but it may be better to say to your employees, I advise you get into the exchange when it comes in. Yeah. It's unfortunate, but there's going to be a lot of that.
Or maybe employers just could provide a basic fee and say, we'll give you X amount of money towards your health care, and you go buy it in the exchange.
Well, there are various types of vouchers, and there's a lot of different programs that companies need to sort through working with companies like Mike's. Mm-hmm. The reality is there's a lot of moving pieces to this. As Mike said,
complicated.
The unfortunate piece is not a lot was done in terms of containing costs. All the numbers we see say it's going to be more expensive in the out years.
All right, we're going to run to a break. I'm going to ask Mike when we come back about insurers. How do they prepare for this change? This is earth-shaking what it's going to do to our healthcare system. I think everybody agrees with that. All right, more on this important topic after talking about cost after we pay some bills.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care.
Hi, welcome back. Well, we're into a conversation, an important conversation about the implementation of the health care law passed in March of this year. All right, look, Mike, let's talk a little bit about, okay, you insure millions of people. You guys are the largest insurer in the...
4.5 million.
You know that number, right. In the Commonwealth of Pennsylvania. You deal with a lot of other insurance companies that work with you. What are you telling the people that you work with? That you know have a relationship with you. How about it? This change. What does it mean?
Well, there's a lot of implications for us, Terry. One of the things that we're going to have to do is we're going to have to be more what we call retail focused. Mm-hmm. So if people are starting to buy health insurance through exchanges, we're going to have to know how to work with that, and how to play on that exchange, as well as how to deal with more individuals who are going to be buying coverage as opposed to through employers. We're also going to be working more closely with employers on how to manage those costs so that we don't disintegrate the employer-based system. We happen to think that's a good system. Yeah. And then the last thing is finding different models to manage costs with the health systems, with the doctors. We're working very hard on that. Yeah. Those are all the things that we have to do to prepare, and I think they will pay dividends.
Yeah. You hear from, I mean, I was stunned, you know, when healthcare, when it got to $12,000, $13,000 a person, and people would tell me, employers would tell me that, you know, I now pay more for my employees' health care per year than they pay for their home mortgage. I mean, I was actually stunned when people people would tell me that. So what is it that you think, you know, that employers have to tell their employees? I mean, you think they need to have one of these you know, these big conversations with them about, go ahead.
Probably is. I think that, you know, one of the things that we'd been working on from the business community was that this initiative should have focused more, as we heard from Mike, on cost containment. It didn't. It didn't focus on how we drive costs down in the old, how we bend the cost curve down. It doesn't. All the numbers we show that it will continue to cost more. I think employers have got to tell their employees that the money that's going out, while it's heretofore been more direct, now it may be indirect. They're going to be paying it in taxes. There's lots of taxes embedded in this that they're going to pay one way or the other.
You know, I didn't think, now you can, if you disagree with me, that's fine. You know, I know it was important to cover people who, you know, have pre-existing conditions, and I know that, you know, some people lost coverage from some, you know, companies for various reasons. But you know what, I didn't think that was a lot of states had already moved in that direction. Do you think that's a critical element of it, or is the more important, or maybe they're all important, that, you know, how many people are we now going to try to cover in Pennsylvania that aren't covered?
Yeah, there's probably about 1.2 million people that we're going to try to cover because of people that didn't have health insurance, and that wasn't all as a result of pre-existing conditions, by the way. Some of that were people who chose not to buy health insurance.
The immortal ones.
That's right. Exactly.
What are we going to do with the immortal ones? We're talking about, you know, our kids, you know, they get out of school.
And Terry, you bring up a great issue, and I have to talk about this. I think one of the things that the administration thought was really good was getting more people access to coverage by eliminating pre-existing conditions. And that is a good thing. However, what we're very concerned about is that people may buy health insurance when they need it. They may pay the penalty otherwise because it's so expensive. So we're very concerned about maintaining a stable pool of people in order to stabilize premium rates. That's a really important issue.
And I think, I mean, and I hear from the folks in the medical community directly, and we've got about 45 seconds, they're concerned that this could overwhelm the immediate health care system. I mean, once it gets implemented. Is that
If you look at the Massachusetts experiment, that's really what happened up there. They did insure more people. There was less access, arguably, to health care providers than they had before.
All right, we're out of time, but I guess we would all agree that, you know, covering as many, we all want people to have health care coverage in one form. The question is how we get to it. All right, as always, thanks for watching Pennsylvania Newsmakers, and I always end it this way. Stay well.